it is through our technology transfer centers. In this case, Southeast Addiction Technology Transfer Center. Our main focus at SATTC is to take things that are evidence-based practice, things that we know from research work, and really try to turn them into practice-based evidence to make them accessible for clinicians and for people working in the human services profession to really best serve those that we're there to care for and that we have the privilege of serving. There are actually three types of TTCs. We are Addiction Technology Transfer Center, but there's also a Mental Health Technology Transfer Center, a Prevention Technology Transfer Center as well, and all of us seek to meet needs in those different areas. A snapshot of what that looks like when you look at a map across the United States. We're in Region 4 in the Southeast in our case, but there are 10 of those overall. And again, you can see it by color, with blue being the Addiction Technology Transfer Centers, the orange being mental health, and green for prevention. We are one of those 10, and we're located at Morehouse School of Medicine in the National Center for Primary Care at Morehouse in Atlanta, Georgia. We serve the states of Alabama, Florida, Georgia, Kentucky, Mississippi, North Carolina, South Carolina, and Tennessee. And of course, in the case of webinar, we welcome anyone from any area. You're always definitely welcome to attend. We do encourage you to check out our other offerings as well. If you put in SATTC into Google and put in addiction, it should be the second or first thing that pulls up. It's really easy to access, and there are a lot of resources there as well. At the very end, one thing that we will ask you to do is to complete a brief evaluation. And when I say brief, it's usually less than 2 minutes. It's really short and sweet. We'll put a link in the chat at the end of the training that should be able to make that accessible for you. When you click on that, it should open in a new tab, so it won't close you out of what you're in. You won't lose your place in the training itself. So it'll be there and will be available for you as well. So now, without further ado, for our training, I do want to take just a moment to introduce our speaker today. Nicole Deems is Ed.S., LMFT, LAC, CS, RYT. That's quite a mouthful. Has quite a number of credentials. She received her undergraduate degree in psychology from the University of South Carolina, where she returned for a graduate degree in counselor education, specializing in marriage and family therapy. Nicole's worked with LRADAC, one of the leading substance use treatment centers in the Midlands of South Carolina, since 2006, and is currently the Director of Clinical Advancement, where she provides clinical supervision, coaching, and training for agency staff. Nicole's experience has been providing therapeutic treatment services to children, adolescents, adults, couples, and families in areas related to mental health, substance use disorders, trauma, and family systems. Nicole operates a clinical private practice where she provides therapy, training, and consultation, as well as clinical supervision to those seeking licensure as an LMFT or certification as an addictions counselor in the state of South Carolina. Nicole's passionate about health and wellness and believes that healing occurs best with connection and intention. She's completed a 200-hour training as a registered yoga teacher and is trained in trauma-informed yoga practices for the healing trauma of trauma and recovery. Nicole sees her work as improving the lives of individuals as well as building stronger, healthier communities. In addition to that, she also is currently the president of Addiction Professionals of South Carolina, is a consummate clinician, a wonderful facilitator, and I'm very pleased to call her a colleague. I know you're in for a wonderful time today and look forward to working with you. Thank you so much, and I will turn it over to Nicole.
All right. Good afternoon, everyone. I'm going to share my screen as we get started here. All right. So that was a big mouthful to hear all that about myself. But I'm here with you today to really talk about preventing burnout. And one of the ways I talk about this is through the lens of self-care, but really starting with an intentional and mindful practice around it. So a few things before we jump into the content is that it is going to be rather difficult for me to monitor the chat while I cover some of the content for the training. So if you do have questions, or as you may have questions, feel free to feel free to throw them into the chat. I'm going to take a pause about halfway through and see what might be in there, and we can open up a little discussion or just Q&A at that point, and then I'll save a few minutes again at the end for some additional questions at that point. I do hope that this is a training that does two things. Is one, it prompts a different level of thinking and awareness about maybe how you're taking care of yourself and what burnout or compassion fatigue might look like for you or feel like for you. And then two, I hope that it may give you an idea of what are some practical strategies to prevent those things. So a little bit of awareness and hopefully a little bit of skill and strategy there. All right, so like I said, we're going to talk about burnout, what it is, what it isn't, why it happens. The other words that tend to come up around that is either secondary trauma or this idea of compassion fatigue. And they do overlap and they can be very similar, but they can also be quite different. So we're going to talk a little bit about that. We're going to talk about self-care as an intentional practice. So not this passive after the fact thing we do to take care of ourselves when we're already burnt out, but how do we kind of put that on the front end of our work? And then we're going to talk about the difference between micro and macro self-care skills. So just a couple of things before we get started is this is an online training, so I know that always makes it a little bit more difficult to participate and engage actively, but I do encourage you to participate to the extent you're able. Primarily, if you are in a position to limit distractions, give yourself permission to do that for about the next hour and close to a half. I'm a big believer that there's very little right or wrong information, but there's a lot of new information out there for us. And so that's another one of my encouragements is just be willing to consider something new, maybe something different, or at least similar information, but maybe presented in a different way and how that might resonate with you differently. Along that same line, be open to other people's experiences, feedback as that may come across today. If you are participating into the chat or in any question and answer, please make sure that you're only sharing what you really feel comfortable sharing. So this is a professional setting and we want to respect everybody's privacy, but some of that's also going to depend on what you share. And then lastly, but probably most importantly, especially given the topic for today, is make sure that you take care of yourself. So if you do need to get up and stretch or get a glass of water, please feel free to do that. All right, so we're not going to have this discussion, but what I do want you to think about is what are some of those factors, maybe personal beliefs or values that you have that really tie your work into something that's meaningful for you. I don't know that anybody signs up to do this work because it's easy, right? So even on those difficult days, why is this work that you do important? Is there a personal passion there? Is there a belief about change in humans and healing that really pulls you into this work, right? So I think that start us out with is something that's really important to kind of organize our perception of our work, even when it's hard. And it's also, for me, the way I like to visualize it is like an anchor point. So lots of things in my work can pull me in different directions because of different stressors, because of different circumstances that clients or patients bring in to a therapy or treatment setting. But the reason I show up remains pretty constant, right? So I think that's something that is nice to be really aware of and be able to kind of reorient yourself or use as an anchor point to kind of keep you tied to why you do the work, even when it's hard. The other thing is that we all have unique challenges. We all have unique experiences. And so there are going to be things that come up in the work that we do as substance use professionals that is hard for us, right? So what are some of those situations? Is there a particular aspect or condition that sometimes you find yourself having to work in that has the potential for a negative outcome for you personally, right? So maybe that takes a lot from you emotionally. Maybe it takes a lot from you time-wise, resource-wise. That could be client or patient-centered. It could also be the environment, right? So think about that. What are those kinds of situations that really pull from me more so than sometimes I have to give? All right, so what is burnout? So burnout is a state of emotional, mental, and often we confuse this because so many of us are exhausted these days, but that emotional, mental, and often physical exhaustion brought on by prolonged and repeated stress, right? So it's not just a bad day. It's not just a difficult week, right? We're talking about repeated stressors that really take an emotional, mental, and physical toll on us. Some characteristics of that you may have experienced yourself or seen in other people include cynicism, depression, and that lethargy piece that just, low motivation, low energy, both physically, but also mentally and emotionally. And obviously, all of those things start to impact our work performance. Why does burnout happen is another really good question, because clearly there's a lot of people doing this work who have experienced burnout, but there's a lot of people who, thankfully not all of us are walking around in the state of burnout all of the time. So like, why does it happen? And most often we know that it occurs when a person's not in control of how their job is carried out, or that they are asked to complete tasks that conflict with their sense of self. And so that is part of the reason I wanted to start the training with, like, why do you do this work? What is really important to you? Because a lot of times it's not, burnout doesn't happen because we have hard cases or because we've got a really difficult client or patient. It's because there's a lot of things that are outside of my control in terms of how I'm doing my job, or there's things that are expected of me that really conflict with my sense of self, maybe personal values, personal passions, that kind of stuff. When working toward a goal that doesn't resonate, or when a person lacks external and internal supports. And so we're going to talk about internal and external supports and resources a little bit, but that is something that also makes a big difference of what makes us able to do the hard work and stay in the hard work. A lot of times is the work resonating with us, but also, like, what are the supports that I need to be able to do the work, and do I have those? Because no matter how passionate I am, no matter how much I want to do the work, if I don't have the adequate resources internally and externally to support me in that, there's going to be a cost at some point. All right, so what is burnout not? Burnout is not working long hours. That may be a component that exacerbates it, but it's not just working a lot of hours. It's not actually the significant workload, right? So like I said, that can be contributing to burnout. But if there are other positive factors that help us have that sense of connection and meaning in our work, then those two things alone are not going to result in burnout. Stress is different than burnout, right? So a lot of times we may have a stressful session, we may have a stressful day, we can have a stressful week, right? Like if you're working in a treatment team setting and somebody is out, that week is probably going to feel more stressful because you temporarily have limited resources or less resources than you're used to. That's going to feel stressful, but that's not going to be the same thing as burnout. So short-lived stress is not burnout. When stress becomes chronic, it is often one of those big contributing factors to burnout, right? So it is that demand that's being placed on you, and it exceeds the resources that you have available. Burnout is also not necessarily trauma related. And so we're going to get into a little bit of that here in just a moment. But I think it's important to say, like, okay, what is burnout? And then what is it not? Because burnout is one of those words that I think our field throws around a lot. And I don't know that that's always what we're describing. So I think it's helpful to say, like, yes, any of these things, working long hours, having a really difficult workload, having to encounter a lot of stress, there being some kind of exposure to trauma, or my work being trauma related, like all of those things require a certain amount of resource, will eventually have an impact on us, but by themselves, that is not burnout, right? So when we are talking about trauma exposure, one of the things that I also want to differentiate is what is secondary trauma, or what's also known as compassion fatigue, right? So this is a quote from Feigley, who really was one of the first people to start looking at compassion fatigue. And so their definition is when we have not been directly exposed to a trauma scene, but we hear the story told with such intensity, or we hear similar stories so often, or we have the gift or curse, depending on how you look at it, of extreme empathy. And because of those things, we suffer. We feel the feelings of our clients, we experience their fears, we experience their dreams. Eventually, we lose a certain spark of optimism, hope, and humor. We tire, we aren't sick, but we aren't ourselves either, right? So I think that's a nice description of what it's like to experience compassion fatigue. And I think it's interesting. I found this bit of information about Mother Teresa. So when she was having to write one of her plans for her work, and her nuns that followed her, she had written to her superiors that it was mandatory that her nuns take an entire year off from their duties to allow them to heal from the effects of their caregiving. Right. So I think that's like, I mean, the idea of taking an entire year off probably isn't relative to most of our work, or possible, but it does make me think of like the reality of what we need to do and able to be present and well doing the work that we're doing all of the time, right? That as people going into experiences and to work with other people who are really hurting, we have to heal from that work, right? We have to kind of fill ourselves back up. And Mother Teresa seemed to understand that really well. So a few other things about compassion fatigue. It is the emotional residue. I kind of like that idea because it just kind of like sits with you. The emotional residue or strain of exposure to working with those suffering from the consequences of traumatic events. It can coexist from burnout, but it is different. And compassion fatigue can occur due to exposure of just one case, or it can be cumulative, because we are consistently exposed to trauma. And I think regardless if you are a professional who is doing trauma work, or you are, specifically using some sort of evidence-based practice to treat trauma, that we're all exposed to it, right? That I don't remember now who I first heard this from, but it was many years ago, that the life of active addiction is often traumatic in and of itself, what it costs, what it takes from us. And so if we are working with people who are using substances or in early recovery from substances, or we're supporting family members who are walking alongside other people in that process, like there is trauma exposure. I don't know that we can get away from it. So we really want to be careful about compassion fatigue. So these are some of the symptoms of both burnout and compassion fatigue. And, this is why sometimes it gets confusing of like, what am I experiencing? But emotional exhaustion is probably one of the things that comes up a lot. That could feel like I just start to get numb. I'm not as emotionally reactive or responsive to situations when I'm working with clients, or when I'm responding to my team or to colleagues. I can experience a reduced sense of personal accomplishment and meaning in my work. So does my work kind of fill my own cup back up? And I don't know that we really want our work to be the only source of accomplishment and meaning in our lives, but I know we spend a lot of time at work, and a lot of people do this because it does feel meaningful to them. So that's not necessarily a bad thing. But when that gets reduced, when we don't find that our work matters, I know one of the things that I talk to a lot of newer clinicians about is when they first start to recognize how difficult it can be to really walk through somebody to a point of what looks like success, right? And what I'll hear a lot of times is like, oh my gosh, it just feels so hard to get somebody to a point where they're successful, right? So if we're thinking like discharge status and all that kind of stuff, and the reality of how many people show up and for whatever reason struggle to continue to engage. And so they end up being discharged with incomplete treatment episodes, or people who just really struggle and have to get moved to higher levels of care or just kind of disappear, from the treatment episode altogether. Sometimes that can really cause people to question, like, why am I doing this? Like, it's so hard and I don't see a lot of success. I joke that it's one of the reasons I really like to cut grass, is because it is like immediate gratification, and that's not something we see a lot in our work. We don't really see the immediate benefits of the work we do, and so it's important to stay tied to the meaning of why we do what we do. So not just emotional exhaustion, but also mental exhaustion, right? So this work is hard. It asks us to think creatively. It asks us to be listening and to be responding to people and situations all day long. And so that can get mentally exhausting. Another important sign to kind of be on the lookout for is when you start having decreased interactions with other people, and especially if that starts to look like isolation. So that could show up in the workplace if you stop consulting, if you stop asking for input, if you stop going to other people for support, on your difficult days or your good days, right? So if you just kind of find yourself withdrawing from your work team, that could be a sign. And then it could also happen personally, right? So if you aren't engaging socially, you're not connecting with family and friends or other community events in a meaningful way, maybe because of the exhaustion, that could also be a sign of either burnout or compassion fatigue. I think this one shows up a lot and sometimes gets excused for the impact of just doing this work over a long period of time. But when we start to get kind of like callous and dismissive of the impact of substance use disorders and addiction, right? So when we start to like depersonalize the work, and we start to make light of the symptoms or the consequences of substance use disorders and addiction, that can be really significant. I know that as a brand new clinician, it was one of the things that I had experienced of, going in and talking to people who'd been working in the field for a long time, and sometimes feeling as if there was an emotional disconnection, and it was just kind of like, oh yeah, that happens. And it didn't always come across. I'm not saying that these people didn't care. They were amazing clinicians, but there definitely was that depersonalization present a lot of times. And so lastly, another sign to kind of be on the lookout for is that physical exhaustion piece. So you can see exhaustion shows up here lots of times in lots of different ways. And if everything else is going on, then of course it just takes this physical toll from us, right? So when we just physically get tired, we're having a difficult time waking up, we're having a difficult time resting, low motivation again, low energy, and we just can't, even with rest, we don't feel rested. So those are all signs to be on the lookout for. These are where we want to start looking at, like, okay, what might be really more specific to compassion fatigue. And as you can see, these are a little bit different because this is where it really starts to get into either having some nervous system responses because of the impact of trauma. And it really starts to have that emotional and cognitive, right? So we're really starting to look at maybe what would be considered a more clinical presentation of exposure to trauma. So if we've got increased arousal, increased hypervigilance, any of that nervous system arousal that just makes us a little bit more anxious, a little bit more vigilant. A lot of times that will start to show up as sleep disturbances. So that's something to really pay attention to. When our emotional intensity actually increases, and a lot of time that's because our nervous system is also more aroused and activated, we want to pay attention to that. So maybe I get overly reactive to things that I wouldn't have. Maybe I'm quicker to respond emotionally to something that I previously would have had maybe a little bit more capacity to exercise both emotional and cognitive faculties at the same time. When our cognition seems to decrease, and that's probably going to show up more so as it's connected to the next thing in kind of maybe impulsive behavior or things where it starts to look like maybe our judgment is impaired, primarily because it's starting to be driven by a higher emotional intensity, right? So that decision making is going to get compromised, and so then some of our behaviors and our judgments might start to look different. We talked about isolation before as a sign of burnout. With compassion fatigue, isolation is probably going to show up, and specifically because of this loss of morale, right? So it's this loss of, do I make a difference? Does my work matter? And if my work doesn't matter, then probably no one else's does either. And so I really just start to like close in. It could meet clinical criteria for depression or PTSD. And we also want to be mindful that if I have one of those diagnoses in particular, and anxiety probably as well, then I may also be more likely to get triggered or suffer from compassion fatigue. Loss of self-worth, difficulty with modulating emotion, identifying the way I view the world, my personal identity, maybe my beliefs or spirituality might start to be impacted by exposure to trauma. That could also be connected to a significant loss of hope or meaning, and experiencing some of that existential crisis. And then emotionally, a lot of anger starts to show up, whether it be towards systems or events, a lot of things that don't seem fair. And this idea of like wanting like judgment and wanting somebody to pay for the consequences a lot of times can show up. So as you can see, those do definitely start to look different than the symptoms we looked at that could be burnout. So like I said, knowing the difference does matter. Usually compassion fatigue has a more rapid onset. So if I've got new trauma exposure, or maybe I'm getting into the field and so I've got some chronic trauma exposure, compassion fatigue is the symptoms are going to show up a little bit more rapidly, which sometimes is helpful because it really starts to show a change in the person, right? So for yourself or for your colleagues, if you notice a pretty quick change in how a person is working, how they're showing up, we probably want to check in with them around compassion fatigue. Burnout is going to emerge a little bit more slowly and over time, because if you think back to an earlier slide, it's going to be that chronic ongoing stress that doesn't really change. We don't get relief from, and so the burnout's going to happen a little bit slower. So on one hand, that can be a good thing because we have more opportunity maybe to intervene and do some prevention matters or do some interventions that decrease the likelihood that the burnout has a really significant negative effect. But also sometimes because it does happen so slowly over an extended period of time, it just doesn't land on our radar because the change isn't so obvious. And so for that reason, I think it's important to have a way to check in with yourself, every 6 months, every year. And we're going to talk about one of the ways to do that in just a little bit. But we really want to be mindful of looking for signs of both, but also recognizing how they could be different. Compassion fatigue does tend to have a faster recovery, at least if it's less severe and if it's recognized and managed earlier, which I think is interesting because we would probably tend to think that the impact of trauma exposure has more lasting effects. And what research has shown us that when we intervene on compassion fatigue and help people with skills and resources, they really are able to bounce back from it. When burnout emerges and it's not been dealt with, usually the cost of that just gets extended over a period of time. And it really starts to have an impact on how people show up at work, and it damages relationships. It may damage like kind of the professionalism, and a lot of times feels a lot more challenging to come back from. So we're going to kind of move, now that we've had a couple slides to talk about burnout and compassion fatigue and what it is and what it isn't, and how do we be on the lookout for it. I want to move into kind of what do we potentially do to prevent it. Before I do that, I'm going to take a moment to check the chat box to see if there's anything. Yeah, okay, so compassion fatigue is going to, that's a good question, and I apologize if that wasn't clear earlier. So compassion fatigue is going to come about specifically because of exposure to trauma. So it's the same idea as what we also call secondary trauma. So the language compassion fatigue actually came about as a way to broaden kind of the lens of how we understand trauma, right? So a lot of times when we label something as trauma, it can fall into a really narrow array of events, right? And so one of the things that trauma-informed care has asked us to do as a culture within behavioral health is really come to awareness that like we cannot really define what is traumatic for people, and because anything could be experienced traumatically potentially. And so if we take that broader lens, then really looking at secondary trauma also kind of puts this bracketed label around, was it actually traumatic, right? And so compassion fatigue is this, it's really just another way to talk about secondary trauma, but in a way that says, as a human being, when I show up to compassionately connect with somebody else who's experienced trauma, I get exhausted by that. There's an impact to me on that. So that turns into some sort of fatigue on my internal resources and systems. So I hope that answers that question. You're very welcome. Any other, before we move on, just quick questions or thoughts at this point? Yeah, Michael. Yes, Michael, I can definitely do that. So I think in terms of personal experiences, I can speak either like some of this might be my own personal experience as a clinician through stages of burnout, but also as a supervisor, is that typically when I see burnout, it is because of work conditions and limited resources, right? So sometimes work conditions can be the work environment and the setting that I'm working in, right? So if I have really limited there's a little bit of feedback, so if you guys can double check if you're muted, that would be super helpful. Okay, thank you. So lack of resources. If my work environment doesn't have like an adequate treatment team, maybe if there's really rigid rules, there's not a lot of support available, then that can turn into burnout. Sometimes it's, I've got a great team, but I work in a really small area and there's only 2 clinicians, and one of them is really new. And so we just don't have a lot of resources to pull from internally. And so that sometimes can lead to burnout. I think with secondary trauma or compassion fatigue, I think that is something I know for me shows up first emotionally, and then physically. And so one of the things we'll talk about with self-care is starting to be aware of kind of what your tells are, because we're going to kind of experience that differently. But I know for me, being exposed to a lot of trauma, usually that starts to show up through emotions, right? So I can get overwhelmed more easily. In the past, I've struggled, not necessarily in the session, but after the session with, a lot of worry and feeling inadequate, whether that was from a skill perspective or just like, I don't know how to help this person. And I know we've probably all felt that way at some time, but does that get resolved in some way, or does it just linger? And so that's going to kind of lend itself, if it's not resolved, into some more compassion fatigue. I don't think that, I think countertransference could be a risk factor for secondary trauma or compassion fatigue if we don't identify that as what's going on and we don't get support and resources to deal with it. So I think anytime we're experiencing countertransference, so when I'm sitting with a client and I'm starting to recognize and have personal reactions, because maybe the story is too close to home, or it's hitting me in a personal way, not just in a professional way. If I'm not aware that that's happening and I don't have the support to kind of manage the countertransference, then I think that could be a risk factor. But it's not. But the transference and countertransference are going to happen regardless if burnout or compassion fatigue are going on too. So it could be, but not necessarily. All right,
So,
you guys are asking.
I'm sorry.
No,
I'm just, I think I understand compassion fatigue, but I think I need a little bit more explanation. So let me share this with you. Perhaps you can tell me if I'm on the right track. So it sounds like compassion fatigue is only involved, it comes about when we are actually helping someone. We ourselves can't experience compassion fatigue on our own. Am I correct?
So let me make sure I'm hearing you right. Compassion fatigue is something that we're going to feel,
Or
but
experience?
it is our experience as a result of helping other people.
Exactly. Is that what you're saying?
Yes.
Okay. So we ourselves individually, we cannot experience compassion fatigue on our own. It has to be such that we're helping others in which we would experience that.
Yeah, so I think that is a good way of differentiating maybe burnout versus compassion fatigue, because I could experience burnout as a result of like if I'm not in a helping professional role, right? I mean,
Exactly.
lots of professionals experience burnout, but where compassion fatigue is different is it's going to be about my interaction, helping and showing up with other people who are hurting.
Okay, so I got it. Thank you.
Yeah, you're welcome. All right, so let's get into a little bit of the prevention. And so we've got the ABCs of prevention. And the first one is awareness, right? So we want to bring some awareness to how do we deal with burnout and or compassion fatigue so that we can stay in the field. So the first thing that we really want to be able to do is make sure that we have some practice that allows us to increase awareness over how we are being impacted and how we are experiencing our work, right? So is our ability to function being interfered with as a result of our interactions with our patients or clients, right? Are we aware that when sitting with someone and they're telling me about their own story, that does that situation or incident not seem typical or ordinary, right? So do I have a good sense when I'm sitting with somebody over, oh, okay, this sounds like a typical hardship, or how do I know when it starts to feel traumatic? And so that gets into sometimes why we don't want to label. Through trauma-informed care, I think we've done a good job of saying, when we ask people, have you had a traumatic event in your life, that a lot of times we get a no to that. That doesn't mean that they've not experienced something that feels traumatic. And so it's always interesting to me when, if I've asked people, has something traumatic or really difficult ever happened to you? And I get a no. And then I may ask it in another way, and they start telling me the story, and I say to them, oh my gosh, that sounds traumatic. And they're like, yes, it was. But, 5 minutes before, if I just asked, have you had a trauma? They've told me no, right? So bringing some awareness into our ability to differentiate those two. Compassion stress, right? So when I'm being compassionate, the stress that brings about, does that impinge on or break through normal boundaries, right? So am I more likely to self-disclose because of the stress I'm feeling, right? So these, again, I don't want to go through all of these because of time, word for word, but it's really starting to say, like, how am I aware of how this work is impacting me, right? Am I aware of how I'm waking up in the morning? Am I aware of how I'm feeling about my work being hard, right? Like 5 years into the field, like, yes, I think we have experienced different kinds of challenges with, say, the opioid crisis. But it's not like the work was easier before then and now it's all of a sudden harder, right? But like, how do I feel about it, right? Am I becoming more easily frustrated? Am I more irritated, right? So a lot of this is just really starting to bring your own awareness into your work, so that you know how you're showing up. So the B is bringing balance, right? So in order to address anything, I've got to be aware of what's going on, right? What are those symptoms that are starting to show up? And then once I start to be aware of that, what do I do with it, right? So this idea of bringing some balance into the work. And a part of that is going to be self-care, which we'll get to. But we can start to look at this in terms of, like, what am I doing to nurture myself? What am I doing to make sure that I'm experiencing pleasure, joy? I've got some distractions. A couple of weeks ago, I was away doing a 5-day residency for a university that I sometimes do some teaching for, and they were like really long days with students, and then we would have faculty meetings at the end of the day. And so in my head, I was like, oh my gosh, I'm going to be in a hotel room by myself for 4 evenings. I'm going to be able to read and get my calendar organized. I had all the stuff I was going to do. And by the end of the third night, I ended up watching cat videos on my phone for like an hour because my brain just needed a huge like break from anything meaningful or organized, right? And afterwards, I was like, oh my gosh, I cannot believe I've been on my phone for an hour watching cat videos, sending them to my daughter, being like, oh my gosh, look at this one. But I really needed a diversion, right? I just really my brain really needed something else to focus on, besides what we were teaching that day. Right. So can you give yourself permission to take mini escapes, kind of help you modulate the intensity of your work? How do you have a meaningful way to transform the negative impact of your work, right? How do you find meaning? How do you find gratitude when things feel really negative? Is there a way that you can challenge that and see a different opportunity there? And then I don't want to say last but not least, as if it should be the last thing you get to, but I do think part of like bringing balance into ourselves is making sure on a regular basis, like, we are okay physically and emotionally. And so sometimes that is going to mean we're going to the doctor to make sure that we are physically doing okay, that maybe we have our own therapist or our own peer support network, that we are getting support, especially if we're starting to experience symptoms. So making sure we have that active balance going into the work we're doing. So these are just some questions to ask yourself. One of the things that I like to say from a language perspective is balance is not something we find, it's something that we create, right? And so these are just some questions to kind of prompt yourself to think about, well, what could I do to bring balance into my work and to balance my personal and professional life and to limit the impact of compassion fatigue or burnout. And a piece of that is going to be identifying what are the things that fill you up, what are the things that you do that naturally give you energy and enthusiasm, where do you get passionate, who are the people, what are the issues, the topics that you get the most excited over, and how do you make sure you're plugging into those things, and what do you have in your life that gives you that sense of purpose and hope and joy. And some of that is going to be around your work, but some of it should also be personal too. And it's nice when we get to like pull in some of our personal passions and excitements into our work, but it is also important to have some separation sometimes between those things too. Just a few reminders, we all have internal sources of power and healing. And so we have to be intentional about accessing those things and really using the resources that we have. And balance involves putting things together in your life that we have, that we value and we get excited over, like literally into our schedule, right? They have to be prioritized, and those have to be things that are active in our life in order for us to benefit from. So these are just some examples of maybe some things if you are a person who is maybe feeling overwhelmed by the work and you're looking to incorporate a better sense of balance, making sure you're getting some alone time, some quiet time. A lot of times, especially for my introverts out there, that can be really helpful and important. Having an awareness of what restores you and replenishes you, right? So this goes back to the awareness piece of like, I have to know how I'm doing and what I need in order to do that. I think this is something that we don't talk about a lot, because even as a larger culture, we tend to think about grief and loss in terms of death. But, I think in our work, we experience a lot of grief. We get exposed to a lot of grief, and some of that is traumatic grief, but, we just are constantly exposed to people having to say goodbye to things. And even when we want people to move towards recovery and sobriety, like there is a goodbye there. The old strategy of writing goodbye letters, I think is an old way of acknowledging like we are letting go of something in order to create room for something new, which is a good thing, but we do have to acknowledge the loss and the grief there. And then the other extent of that is like we do experience loss of life in our work. And so whether that be losing patients because they just stop coming to treatment, and so we stay really worried about them while they move on with their life, or especially with the opioids and the amount of overdoses that we get exposed to anymore, a lot of times we are having our own grieving process. So making sure we're acknowledging that and having resources for it is really important. I would encourage this for everyone, no matter what work they're doing. But I think in our field, when how we show up at work really has the potential to impact other people, staying clear with ourselves about our commitment to our career goals and our personal missions and visions for why we're doing this work is really important. When I was a supervisor still at Loredak, one of the things that I tried to do with my team was kind of review on a regular basis our professional development statements. Like, why are we showing up? Why is this important to us? Why do we keep doing the work we're doing even when it gets hard? And being really clear about that and using that to map out kind of professional development. So that may be a nice way to bring some prevention in. I think this is another thing that take some cognitive work on our ends, is knowing what to focus on in terms of what we can and can't control, whether that be with our patients and the outcomes that certain patients and clients end up encountering, or just circumstances within our work environment, within our personal environments. But I think being really intentional with what we're choosing to focus our energy on, and making sure to the extent possible that we're doing that around things that we do have some control or impact over, can be really important. And then this is also kind of one of those cognitive shifts of looking at situations as challenges and opportunities, and not necessarily problems or stressors, right? That anytime we kind of bump up against something that has to cause us to pause, whether that be because we're running into hardships at work, whether we're starting to be emotionally, physically impacted by our work, really looking at that as an opportunity to learn and grow, and not just necessarily an inconvenience. And so I think that can be a really helpful mindset to have, because especially if you're choosing to do this work, which I hope you all are, then we're choosing to do hard work. And so if we're I gave feedback to somebody the other day. They were talking about how difficult it was as a clinician when you're constantly, being corrected on documentation, or, being told like, well, maybe you should do this next time in group, and just, struggling with that confidence and competence piece, and how difficult that is. And, I kind of talked to them about that parallel process piece of, I wonder what that's like for our patients to get that same message constantly, right? Stop doing that, put that down, pick this up, maybe you should try this next time. That, this is a hard situation, right? And so there's no one right way to do it. And so how do we look at some of these challenges as opportunities to be flexible and learn how to adapt and grow into something different, and not automatically as a negative. So in our ABCs, the last thing in terms of prevention for both burnout and compassion fatigue is going to be around connection, right? So this is, what are you doing to really make sure you're connecting to other people, and connecting to adequate resources to help you in that prevention. So one of the things that I always think about is the difference between like venting and like when we're actually going to somebody because we need something, and being intentional of like who we're choosing to do that with. There's nothing wrong with venting. I think from time to time we all need just an outlet, but I think we have to be careful of like, are we going to people venting and maybe they don't know? Are we just venting, or are we looking for something more? Or are we going to somebody and we're venting and they're probably not the most helpful person to vent to? In the similar conversation I just mentioned that I had recently with a group of new clinicians, one of the things that they said is, when I don't know what to do with a patient, one of the first things I do is go to a colleague, which is great, right? Like reaching out for connection, reaching out for support. And they said, but I only go to my supervisor when none of that has worked and I'm frustrated and I just want an answer. And part of me thought that was really interesting to say, like, not that you shouldn't be going to your colleagues and your peers, but in like, what would that be like to go to a supervisor before you got frustrated, right? Like, what could you actually learn instead of like, I'm just looking for an answer. Can somebody just tell me? And I'm going to trust that you know how to solve this problem for me. So, I think being really intentional about who we're going to and who are we talking about, what's stressing us out and what's really hard is really important, right? So making sure that we have people who can listen and understand. In the class I just taught, one of the students asked, how difficult is it to be married and to have all this confidentiality and not be able to talk to your spouse about it? And I was just like, that's the last person I want to talk to this stuff about. One, because I want to keep kind of that separation and not bring a lot of that work home, but also like my husband doesn't, like, he's understanding of people, but like he doesn't understand my work the way another professional does. Like he doesn't he doesn't understand the environment of treatment and working with patients and therapy practices and all that kind of stuff. So like, he's also not the person I'm going to get what I need right now. If I just need emotional support because I'm overwhelmed, like, yes, I can go to him and just say, I've had an overwhelming day and I just need support, and he can give that to me. But if I need to talk about my reactions from, working with traumatic clients or being exposed or being overwhelmed to really difficult situations, like, I need to make sure I'm talking to another professional about that. Making sure that you have that positive support system. And then for my pet parents out there, I think we forget how meaningful sometimes that can be and how connecting that can make us feel, just to have those like non-human, like really empathetic, really compassionate connections, but in a way that's kind of like that unconditional positive regard, right? And that unconditional love. So don't forget your pets and your furry animals when we're talking about preventative connections. All right, so I want to pause. I'm going to check the chat again. Yes, Michael, I agree. New mothers can have unique challenges. And I will say this, I know when my daughter was born, so she's almost 14 now, but when my daughter was born and I came back to work, there was a period of time where I can remember going to my supervisor, and I was doing adolescent services at that point, but I was doing a lot of assessments at the same time. And so I can remember going to her and saying, it feels different all of a sudden doing assessments with these other mothers a lot who were involved with DSS. And it was just one of those first moments where I realized, like, oh, the fact that like I am now a parent and have my own child, like the working with other mothers like just feels different. I can remember having a lot of supervision around that. And it wasn't anything that I like had to stop doing, like I couldn't work with mothers at that point, but it was different, right? And so, I guess a lot of new parents, not just mothers, but new parents in general, are also going to have a different kind of exhaustion going on, which may put them more at risk as well. But compassion stress, compassion fatigue, yeah, those are going to be similar. It may just be like the stressor of engaging compassionately, and then what is the result of that, which may turn more into compassion fatigue. And I don't know, honestly, if you guys will receive a copy of the presentation. We can definitely probably set that up, but we'll answer that at the end, because James or Michelle might have to chime in on how to make that possible. All right. Any other thoughts, comments, questions before we kind of dive into self-care?
Regarding the presentation, I would just say, if you're willing, Nicole, if you send us a copy, we can get that to the participants.
Perfect. I know my email is also going to be at the end of this, so if people could email me too. Okay. All right, so let's talk a little bit about self-care. We don't have time to go into this in great detail, but when I mentioned earlier of like having a regular way to kind of do a brief self-assessment over how you're doing, the Professional Quality of Life Survey does that. And so you can go online and just kind of, you could Google ProQual and it's going to come up. It's a free self-survey. You could administer it to yourself. My only request, and I can't hold anybody accountable for upholding this, but my request is that if you download the measure and you fill it out and you score it for yourself, whether the results are positive or negative, challenging, concerning, I would encourage you to go over them, whether it be with a supervisor, like peer supervision, or more formal supervision, because I think it's nice to get some feedback about, like, this is what I thought it would be, or this is better or worse than kind of I expected the scores to be. But the ProQual is a great measure, to one of those things you can do once a year, just to check on yourself and bring some awareness in. Self-scoring, So it's really easy to do. All right, so when we talk about self-care, one of the things that I find really important to stress is that self-care can be a proactive and intentional practice. And at the end of the day, it is my self-care is my responsibility. It is not the responsibility of my supervisor to make sure I have good self-care. It's not the responsibility of my agency to set up the circumstances where I have perfect self-care. Like, self-care is my responsibility. And part of that is because my needs and how I use self-care is going to be unique. So I can't expect somebody else just to give that to me. The other thing behind that is, regardless of how well intended our supervisors or our agencies want to be, they're not going to meet the needs of all of the people all of the time. And so we have to take responsibility for those proactive actions, that intentional practice, and making sure part of our self-care is also advocating and communicating our needs if and when they're not getting met. So that's my big soapbox that I'll only stand on for like 30 seconds, is that if you take nothing else away from this, I would encourage you to feel more empowered over your own self-care. So one of the things that I just ask you to kind of think about for just a second is, like, what do you think about when it comes to self-care? And so how do you define that for yourself? And then my question is like, can we shift that in relationship to how we see ourselves professionally, and how we can be more mindful of what we need to really make that happen? So when, I guess technically I still supervise, but not formally for an agency, so I don't have as much responsibility over the day-to-day supervisory role, is when staff would come to me because they needed, I think tomorrow I need a mental health day, right? And so this comes without any judgment, no shame if you have asked for that or have done that in your past. But I think it does us a big disservice if taking a mental health day is our only form of self-care. Because what that tells me is that we are waiting until we can't do it anymore, and I cannot come in tomorrow because I can't see that client, or I can't sit in that treatment team, or I can't do the work and be okay about it, right? And so sometimes that's going to happen because there's things outside of our control that are just too extreme or too intense or too overwhelming, and we're going to have a really acute way to take care of ourselves. Just like sometimes we have to go to the ER. But if we're looking at addiction through a medical model, then I also ask, could we look at self-care through that same lens and say, what happens if we looked at self-care as a preventative measure and took preventative measures to take care of ourselves, much the same way, hopefully all of us brushed our teeth this morning, right? Those of us who are prescribed medications, we probably took those already this morning, right? Like, all of that is intentional and preventative to keep us going in the way we want to. And so, yes, sometimes a situation is going to arise that is unexpected, a crisis is going to happen, and we're going to have to pump the brakes and take care of ourselves in order to keep going. But I do ask that if taking mental health days is your primary form of self-care, that maybe the rest of this afternoon's presentation can give you some more options. So self-care for me isn't something that we do when we're already overwhelmed and stretched too thin, right? Self-care is an ongoing effort, and I use the word self-care practice to really emphasize that this should be something that we're doing on a regular basis if we want to be good at it, right? If I only wait and utilize self-care at the end of a difficult week, well, like, I mean, that's better than nothing, I guess, and might feel nice, but putting it more proactively, intentionally throughout my week is really what's going to keep me sustained in this field for many, many years and doing the work in the way I want to be doing it, right? So we have to practice taking care of ourselves. and advocating for ourselves. I will also say that a part of self-care is making sure that we are communicating our needs to our family and to our friends and to our team at work, because it is really nice when we can get the support for that. I tell this story that when my daughter was really young and it was hard for me to get to a yoga studio, I did a lot more home practice. Well, I guess a lot of people did more of a home practice if you do yoga at all over the last year because of COVID. But aside from that, I can remember when my daughter was really young and, just needing to get that time in for myself, hearing my daughter come like her little feet down the hallway and being like, oh my gosh, I know she's going to come ask me, like, can I have juice or something like that? And I one day remember hearing my husband like say to her, like, do not interrupt your mother. She needs this time. Like, and it was that first moment of being like, oh, not only is he creating space for that, but he realizes there's a benefit, not just for me, but for all of us if I'm taking care of myself, right? So I will say, yes, it is our responsibility, but sometimes we really just need to make sure that we're communicating that need to our family and friends in a way that they can support us in that. So when we're developing a self-care plan, there's kind of 4 ways to look at my self-care. You can look at self-care from a physical sense, from a psychological sense, that also includes your cognitive and mental needs, emotional needs, and then your spiritual self-care needs. And this is just what I will say is that I think it's important when you're looking at your self-care to have options for all of those. But it is my experience that there's probably 1 or 2 of those categories that come more naturally to you. For instance, my father growing up was very athletic. He was a power lifter when I was really young. And then when I got a little bit older, he ran a lot of marathons. And so like we were a pretty healthy and active family. And so as an adult, thankfully that kind of like stuck with me. And so physical self-care is not something that I have to try really hard. It comes more naturally to me just because it's been part of my experience since I can remember. So if I am feeling really overwhelmed, yes, I have a part of my self-care practice that includes my physical needs. But usually if I'm feeling overwhelmed, it is one of those other categories that actually needs something. So I just put that out there as the encouragement of, if you look at those 4 categories and maybe you feel like you're really, really good at 1 or 2 of those categories, a lot of times when we're needing something, right, because we're lacking something, it's going to be in a category that doesn't just come so naturally to you. So I know for me, when I'm needing self-care more so than normal, it's going to be in a category other than physical that I really need to like be intentional about, because going to a yoga class or teaching a yoga class is just going to come naturally to me at this point. So if we are starting to think about self-care in a proactive, intentional way and fitting it in on a more regular basis, then we really need to think about like, well, how does that happen? So a few slides ago, I asked you to think about how do you define self-care? And one of the things that's really common, and if we were in a live group, I would have had you shout out, like, what do you do for self-care? What I commonly hear is I take days off. I go to the gym. I go get my hair done. I get my nails done. I take a massage. I go on vacation, right? And so those things are all really good, but those are not usually things that any of us can do to the frequency that is going to really meet our self-care needs, right? So those are what I'll call macro self-care skills. And what we're going to talk about is the micro self-care skills, because that's usually where we can have a bigger impact, right? So as I just said, the macro self-care is the things we typically think about. Those are our big ticket items. And because they require a pretty significant amount of time, money, planning, some sort of resource, they tend to happen infrequently, right? Like, how often can you really get your hair done? How you only have so many days off before somebody's going to be concerned that you still want your job, right? So those are not things that can happen on a really consistent basis. Should they happen? Yes. Should they be part of your self-care? Yes. but what else can fill in the gaps? So that's where we go into micro self-care. So micro self-care is shifting the emphasis to something that is easily accessible and takes very little, if any, time, money, planning, resource in general, right? And because of that, we can be really consistent and have repetition around it, right? So what are those things that you enjoy that bring you a sense of pleasure, that help you connect to yourself, that doesn't require you to do a whole lot, right? These are the things that we can make changes with much more reliable frequency. Now, the hard thing is that because they are micro, if we're not intentional about it, they won't happen, right? So this is where we have to be intentional about using these things, because if my self-care skill, my micro self-care skill is a breathing exercise for 30 seconds between sessions, if I'm not intentional about that, that 30 seconds is going to go by and it's a lost opportunity, right? So I've got to be intentional about it. But if I can do it with reliable frequency, it makes such a big difference, right? One of the ways that I talk about micro self-care is it is the things that we slip into the pockets of our day that strings our whole day together and allows us to keep going and to keep showing up in the way that we really want to, right? So consistency there is key. And one of the ways that you can do that is think about what are the natural transitions in my day, right? So a natural transition for most people who commute to work is the time they arrive in the parking lot before they get out of their car, right? Like, so what could you do for 1 minute, right? Is there a mantra? Is there a meditation? Is there a reading? Is there a prayer, right? Like, what is it that you could build into that natural transition? A good example for me is not this time of year, but other times of year where it's not so hot. I try to intentionally leave my lunch in my car when I come into my office, because that requires me, because I will eat, I won't go without the food, to get up off out of my desk and to walk outside into the sunshine. Literally, it probably takes an extra 3 minutes for me to do that, but it is so worth it, right? And it makes such a difference to my day when I can, the difference between me being like, oh my gosh, I've not left my office for 7 hours versus having a 5-minute break, right? Where I get to walk outside, I get to see the sunshine, I get to, drink some fresh air. It just makes such a huge difference, right? So consistency is key. We want little resources necessary. And so some things to think about, just some examples of those micro skills could be like the use of mantras. So is there a saying? I worked with somebody who kind of had a mantra that they used every day walking into work, and it was kind of how they wanted to start their day. Breathing exercises is a good example. You can breathe for 30 seconds. If you've got 2 or 3 minutes, you can do an extended breathing practice. But even just having the ability to consciously take an intentional single deep breath, right, gives us an opportunity to shift rather and be intentional and conscious about it, rather than just rushing into the next session or the next meeting or the next thing we're doing. Having rituals for certain times of the day or linking things between your day. So I worked with somebody who we established micro skills around how they walked into work. They had a little micro skill that they did every day after they ate before they started their afternoon working session. And then they had a way that they went home. So they commuted to work. So on their drive home, they had a little practice that they built in that kind of helped them close their day as a helping professional, so they could show up at work as a parent and a spouse. And so you can also think about that. What are just some rituals that I can put into my regular day? This seems like something that should be a no-brainer, but I think it is one of the top things that gets neglected is, are you drinking water throughout your day? Are you hydrated? Whether it be water or tea or whatever you're wanting to drink, like, are you actually staying hydrated, and are you eating? I know so many helping professionals that will just go all day long without having consumed little, if anything. And, that's just not sustainable, right? There's going to be a cost to that. going to the bathroom, right? Are you giving yourself permission to take a 3-minute break and, go to the restroom and get a drink of water? Or are you giving yourself some energy and some nutrition that can really help you get through the rest of your day? Another small micro skill can be things, this is going to depend on your setting, because you do want to be careful with smells or anything scented, but but do you have an essential oil that you just breathe in? Hand lotions can be nice if they're not super strong. I have somebody, and I actually keep one here at my desk that is just, it's a little bit of an expensive luxury item, but if I've had a difficult day, it's nice to give myself a little hand massage, and smells good, and it's not super strong. I've never had anybody kind of notice it after the fact. So, those are all examples of micro skills that you can kind of naturally build into your day and do with a lot of consistency. So, like I said a few minutes ago, in order to do these micro skills with enough consistency, they really do need to be intentional, right? And so the question I ask is, what is the intention of your self-care? And that may shift from day to day. And I do want to talk really briefly about like using exercise as self-care, is to be really careful that the exercise, if you're saying that I exercise or I do something physical for self-care, is it meeting the need and the intention that you're setting? And so, exercise for our health is great, but I don't know that all exercise is created equal in terms of how we think about it or how we experience it. And so if something just becomes a checkbox, or it becomes another thing on your to-do list, or if you don't do it, you feel bad about it, then I don't know that might completely be self-care. Even for me, as somebody who the physical aspects of self-care come more naturally, there's a big difference if at the end of the day I'm exhausted, and do I want to do yoga at home, or do I want to go to the studio and be around other people? Or do I want to go for a run because I've got all this gross anxious energy inside of me and I need to like process that physically? Or do I need to take a walk, when it starts to cool off and isn't so hot and sunny out, right? Like, so being really intentional with like, what is it that my self-care is asking of me? Like, what is my need? And so am I doing a thing that matches that? So be intentional. What is the intention of your self-care? Make a plan around that. So how can I get that done? When in my day can I be intentional about doing that? And making sure that you're adjusting your plan, right? So if my plan is to talk to somebody, connect with somebody on my drive home, because that feels supportive. But at the end of the day, maybe I've just had a really long day and I've seen 7 clients, and the last thing I want to do is talk more, then maybe I don't need to do that, even though that was my plan, right? So being careful that you can adjust so that it continues to meet your intention. And all forms of self-care can exist, not just all of the at the same rate all of the time. So sometimes you're going to want the big things. Sometimes you're going to really need the little things. And sometimes the thing we planned for, we're going to have to be flexible and adapt. My big encouragement here is don't just throw it out the window, right? Don't just say, oh, because I don't have enough time for it, it can't happen, right? You might have to go from, if I really want to go to a yoga class at the studio, I mean, the reality is that probably takes me close to 2 hours before I leave the house and I get there and I set up and I take the class and I drive home, right? I don't always have 2 hours, but I might have 20 minutes on my own bedroom floor, right? So being really flexible and adaptable, but don't compromise your own well-being when things have to change. So I'm going to open up for questions here these last few minutes, but to kind of start to wrap things up, this is just kind of an outline for you to start to think about creating your own self-care plan, right? Making sure that you have an idea of both, micro and macro self-care skills you can pull from. I made a tiny list of things that are common and I've worked with myself or other people on, but a micro self-care skill can be anything. So make sure that your self-care aligns with your natural interests and your passions and the things that feel good to you. Make sure you're reviewing that, right? Like, what are those balancing activities that we talked about? Where could those fit into your self-care plan? And this is a nice way, I think, to kind of chunk out what's doable on a micro and a macro level. Is like, what can I do on a daily basis? What are those things that I need to do on a weekly basis? And what are those things that are still really meaningful but happen less frequently, like vacations and time off and that kind of stuff. And I mentioned this earlier, but consider like your professional development in all of this. Obviously, the better you take care of yourself as a professional, the longer you can stay in the field. But it's also important to make sure as you progress in the field that you're staying aligned with what you're passionate and what's meaningful to you, right? So, because sometimes in our field, we can get pulled into an opportunity that seems exciting, but could actually pull us farther away from, what actually feels good for us. And then that's going to impact the way we feel about our work. So I'm going to leave this slide up. I'm going to check the chat, but also if you have comments or questions, hold on, I've got to find the chat box again. Where'd it go? There it is.
There's one question, Nicole, where Michael was saying, should supervision focus on teaching newer professionals how to develop their self-care? I feel like I had to learn on my own. It was very difficult, maybe, excuse me, maybe even coaching or something.
Yes, I do feel like for new clinicians, as a supervisor, I think it does me justice and the new clinician justice to be talking about self-care and developing a self-care practice. I think that there's this misnomer because we start to talk about self-care in graduate school and like you should do it, but I don't know that we do a real good job sitting down and talking about the nuts and bolts of what that actually looks like with new clinicians. And so we grow up professionally with this idea of, oh yes, self-care, that's something I should be doing. And I think that's where we fall into the trap of mental health days because we don't know what else to do. And that's where we fall into the trap of like vacation is I need to go on vacation. I really need some self-care. Well, I don't know about you guys, but like if I'm taking 5 days off, all 5 of those days are not like super great, right? Like travel and vacation can be stressful. And so, yes, I think part of supervision can be really beneficial, not just with new clinicians, because sometimes I think we need to revisit our ideas of self-care and our definitions of self-care. And are we actually practicing what we would like to be doing? But I think self-care should be part of supervision.
I think that's all the questions that I see right now. I will say that the link for the evaluation is in the chat. And so do be sure to click on that before you close out of Zoom for certain. It won't kick you out. When you click on that, it should open up in a new tab. I'm also about to add, if anyone is interested, an additional upcoming training that we have next week on the 28th from 10 a.m. to 11 a.m. I'm putting that one in the chat currently. And so that should be available as well. Also, those are all available on our website. I always encourage folks to check that out. But I will speak for myself in saying, Nicole, that you did a fantastic job. For me, it was a really helpful reminder, particularly that daily practice. I tend to be one of those, aim for the end zone rather than every yard. And so for me, that's a helpful reminder for sure. Really grateful to you for being a part of SATTC. We do have a couple minutes if there are any other questions remaining. Otherwise, do be sure to click on the link for the evaluation before you leave the room or before you close out. Otherwise, if there are any questions, we'll hold on for just a bit.
I don't have a question. I just have a comment. I think sometimes we have to remember that we are the priority. I think sometimes we commit too much of ourselves to our jobs and other situations in our lives. So once we start having that self-worth, self-love, and putting ourselves first, I think the self-care that Nicole mentioned, as far as being intentional, I think that will come about naturally.
Mhm. Yeah, I think it is about self-worth. I also think that when I ask people like the biggest barriers to self-care, the two most common things I hear are time, right? So, which is kind of prompts the micro macro idea. And the other big barrier that I constantly hear is it feels selfish, right? And so you could tie that to self-worth of like self-care isn't that this idea of self-care not being selfish and it's a necessity. And so how do I give myself permission to take care of myself and even to advocate to the people in my life that I need to do that and I'm going to do that and then that's okay. So
Yeah, I think we're conditioned to a certain extent, and we have to uncondition ourselves
yeah,
to appreciate self-care.
yeah, you have to unlearn to relearn.
Exactly.
Thank you.
I wanted to add the thing too about working in an environment where you feel comfortable and it lines more up with your values is really important.
Mhm.
You know, and I think that evolves because I think when you come into the field, you don't really know what that means a whole lot per se. And then, so for me, I want to always try to work in an environment that's trauma informed and person centered and values autonomy. Um, so to me, that's just really important. And I feel like what was mentioned earlier, like I work now where if some recovery is not for somebody, I can still stay in contact with them by giving them Narcan, checking on them, making sure they got food to eat, that kind of stuff. So that's really important to me. So I just think it's so it makes such a big difference to be happy in the place you work.
Yeah, it does make a big
Feel
difference.
valued by your boss.
Well, and I think, some of us, depending on various circumstances, have more choice and control over that. And so I do realize that sometimes people often feel like they have less options for choice around the environment in which they work. And, there's a reality to that. But I would also encourage people to, get some support and have somebody to talk that through with because it will take its toll, right? And so sometimes we just have to be creative and take some risks, which are hard.
All right. I have 2:29 p.m., so I do want to be respectful of everyone's time now that we're up to a time boundary and go ahead and allow anyone who needs to leave to leave. I know that I'll be on for another couple minutes in case there's any questions or anything that needs to be fielded. I'm more than happy to be a support and help in any way possible. But if you need to get on with your day and actually practice that self-care we just learned about, now would be a great time to do that. And we thank you so much for attending and look forward to future trainings with you as a part of SATTC. Thank you.
Thanks, everyone.
Thank you, Nicole. That was really good.
You're very welcome.
James, I have a question. The training that's coming up next week, I think you said the 28th. Yes. Will we receive CEUs for that training or no?
That specific training does not have CEUs. The majority of them with SATTC does, but that one's specifically a part of some of our faith initiatives. We have quite a number of issues or different initiatives related to combining the faith and recovery networks and ways to collaborate between them. There's some phenomenal resources on that website, but within the faith the faith webinars, we don't typically offer CEUs. If we do, we always advertise them that way though, so that folks do know, but for that particular one, there won't be CEUs provided.
Okay, thank you.
Thank you.
Have a great afternoon, everyone.
You as well.
This survey, it says it has the certificate. Are we supposed to try to do we copy, save that as our certificate?
I will defer to Michelle on that one, or Pam if you're on. I haven't done that in that way. When I did mine, it didn't immediately pop up a certificate, so I can't say for sure.
Yeah, it's got,
I'm sorry, what did he, I can't hear. What did you say, Michael?
when you finish the survey, it has the certificate, like it's got Nicole's name, it's got Ed's purple signature and all that stuff already on
Uh-huh.
it. So do we print that, or we like we copy that somehow?
Yes, if you can't print it, let me know. You can just email me and I'll send a copy to you.
Michael, your hair's gotten so long.
Yeah, I'm at home. I usually got it pulled up, but it is getting long for sure.
It's what fatherhood does to you. Forget to get a haircut.
Yeah, for sure.
And of course, there are lots of thanks and kudos and good job and all of those in the chat as well. I always encourage you to actually take a minute to read those. I promise if there was one negative comment, you would obsess about it all day. So take time to soak in the positives too.
Good reminder.
All right. Well, I do appreciate it. Thank you so much, Nicole, and to everyone who joined today. We look forward to seeing you at future webinars and future trainings and live trainings when those come back online as well. For those of you who are in the South Carolina area and part of APSC, also as a reminder, there's basically a thank you or gratitude training that is coming up tomorrow. So if you're in the area, by all means, reach out or look at APSC and they will help connect you to that as well. Thank you so much.
Have a good day, everyone.
Thank you.